In this video, we will tell you about what is weight gain and its complications. Weight gain is an increase in body weight. This can involve an increase in muscle mass, fat deposits, excess fluids such as water or other factors. Weight gain can be a symptom of a serious medical condition. The factors causing obesity are eating a poor diet high in fats and calories, being physically inactive, lack of sleep, genetics, growing older, which can lead to less muscle mass and a slower metabolic rate, making it easier to gain weight. Several reasons affects and became a cause of type 1 diabetes mellitus. Main reason is the damage or removal of pancreas from the body, which ultimately stop production of insulin, which controls the level of glucose in the human body. The second reason is the automatic destruction of beta cells of pancreas, which may be an autoimmune state. People with specific strains of infectious viruses, called enteroviruses, are more likely to get diabetes. It's long been known that epidemics of mumps, rubella, and Coxsackie viruses have been associated with increased frequency of type 1 diabetes mellitus. Other research indicates that toxins in the air, water, and food might trigger type 2 diabetes in people who are genetically prone to it. Some studies reveal a higher incidence of the disease in people exposed to arsenic, while others have linked it to nitrates, ozone, sulfates, and other chemicals and pollutants. Other autoimmune disease might become one of the cause of type 1 diabetes. A person whose family have a history of diabetes is at risk of developing type 1 diabetes. Hereditary predisposition that is one of the main causes of this disease progression. If a person suffering from any endocrine disease, it may affect the production of insulin, and the insulin levels in the body may be disturbed, which ultimately becomes the cause of type 1 diabetes. Here are many complications related to obesity. These are sleep apnea, other breathing problem, diabetes, heart disease, high blood pressure, infertility, arthritis, fatty liver disease, high cholesterol, stroke, certain cancers such as breast cancer, colon and endometrial cancers. Hormones are key players in regulating weight, metabolism, blood sugar, insulin, and when and where the body stores fat. Any imbalance in hormones causes unexplained weight gain. Causes of hormonal weight gain: thyroid hormone deficiency, estrogen dominance, androgen imbalance, high cortisol, low growth hormone, insulin resistance, metabolic syndrome, POX, growth hormone deficiency. Insulin directly links to weight gain, as insulin causes some of the sugar to stored in the form of fat, which leads to weight gain in human body. This slide tells you about genetic links related to weight gain. Genetic and environmental factors interact to regulate body weight. Overall, the heritability of obesity is estimated at 40–70%. Genes contribute to the causes of obesity in many ways, by affecting appetite, satiety, the sense of fullness, metabolism, food cravings, body fat distribution, and the tendency to use eating as a way to cope with stress. This slide tells you about lifestyle links related to weight gain. Sedentary behavior along with a lack of moderate vigorous physical activity is negatively associated with obesity-related comorbidities. It may seem hard to believe that sedentary behavior can cause health problems, but it's true. It may result in increased blood pressure, weight gain, and many more dangerous health issues. Food addiction indicate that certain highly processed foods can have a high addictive potential and may be responsible for some cases of obesity and eating disorders. Other factors that leads to weight gain are social deprivation, older age, stress and poor sleep, use of certain medication, and taking too much alcohol are the cause of obesity in normal individuals. Stay connected for more healthy updates. Do like and subscribe our YouTube channel.